According to the AOTA website, the Code of Ethics document states that beneficence requires taking action by helping others. In other words, by promoting good, by preventing harm, and by removing harm. Examples of beneficence include protecting and defending the rights of others, protecting harm from occurring to others, removing conditions that will cause harm to others, helping persons with disabilities, and rescuing persons in danger. The Code of Ethics under beneficence goes on to say that occupational therapists must provide evaluation and a plan of intervention for all recipients of occupational therapy services specific to their needs. In our case, the occupational therapist is not following these Code of Ethics. The student that she is supposed to be giving services to does qualify for services, even though she's barely eligible. She still is, which means that under the Code of Ethics she should receive OT services. Just because the fact that the district is underfunded and there's limited resources and they don't have many OTs on staff doesn't mean that the OT should discount this student. The student still deserves to receive the full OT services and should not be treated the way that she is. The Code of Ethics also says that all occupational therapists should report to appropriate authorities any acts in practice, education, and research that appear unethical or illegal. So in this case, the team of medical professionals all agreed to not give services to the student. So the question is, should the fieldwork student address the family of the false documentation? This question for me is tough. I don't think that the student should necessarily directly address the family. I think that the student should try to speak specifically to her site instructor and try to reason with her about this and talk it through. If the fieldwork student does not get anywhere with that conversation, I would maybe try to go to the principal of the school or maybe another OT that works in the same school district just to get the word out. I personally do not think that it's the student's job or responsibility, or I don't even think it would be appropriate for the student to directly address the family. I think that there are other means of doing that that would result in a better situation. Is the student's education jeopardized from the actions taken? I think it could go either way. I could say yes, the student's education is jeopardized because the team of medical professionals is not following the Code of Ethics and not doing the appropriate things. But then again, I think that the student could actually take this as a learning experience and to see what does sometimes happen and what can happen and how it happens, and maybe it can be a learning experience for the student to reason through this and decide what to do and what actions to take as far as reporting it or not reporting it, and so on and so forth. Were the APE, speech pathologist, and OT justified in their decisions? I would say absolutely not. The child qualifies for services and therefore should be given services that she needs. Just because the district is underfunded and only has a limited number of employees doesn't mean that the child has to suffer for that. So changes that can be made to prevent this situation, I would say first and foremost that the district needs to hire another OT and maybe some more medical professionals to help lighten the caseload so that the kids are getting the services that they need and the time and amount spent that they are required. Maybe also some more education on the code of ethics needs to be done to these employees, to these medical professionals. It can never hurt to refresh someone's memory about the code of ethics and the responsibilities and duties that are upon you when you are a licensed and registered practitioner. Other than that, I do think that this child should and deserves services. I think it's very wrong that the assessment showed that she does need services, but then they changed the answers on the score sheet to discount her and to make her not qualify for these services. So overall, I think the OT and the team of medical professionals is way in the wrong, and just because they are underfunded and have limited resources does not mean that they can discount this child.